Hello everyone, I'm Dr. Priyanka, Senior Resident, Department of Radiation Oncology at Dr.KAMAKSHI Memorial Hospital, Chennai. We are in the month of March, and March is observed as the Colon Cancer Awareness Month worldwide. So I am here today to give you a few pointers regarding colon cancer. So as you all know, our digestive system starts with the food you chew in your mouth. It goes into the food pipe, from food pipe to your stomach, and then to the intestine. And from there, all the unwanted food particle is thrown outside. So the intestine is further divided into small intestine and large intestine, or the colon. And here is where all the important food particles, from the food particles, the nutrition is absorbed and the unwanted particles are thrown out. So what causes colon cancer? We are yet unable to single out a particular reason for it, but there are multiple factors which can contribute together for the development of colon cancer. So what are these factors? To start off with, it is consumption of a lot of fatty processed food, consumption of processed meat, obesity, smoking, alcohol. All these factors together can contribute to the development. Also, there are some hereditary syndromes which together can lead to the development of colon cancer. So, what are the symptoms that someone presents with? They can complain of a recent change in their bowel habits. They might have complaints of bleeding when they go to the toilet. They can also complain of severe pain, abdomen. Sometimes, as we divide right-sided and left-sided colon cancer, right-sided cancer present a little late towards the stages. That is mainly because they have very vague symptoms and along with anemia or severe weight loss. So because of these reasons, patients might ignore and they tend to present very late in the disease. Whereas left-sided colon cancer can present with severe pain abdomen because of obstructive symptoms, and that do present much earlier in the stage of the disease. So who are at risk of developing this colon cancer? As I said before, there are multiple factors which trigger the development of cancer, and if you have all these factors as in obesity, sedentary lifestyle, lack of exercise, consumption of excessive fatty processed food, all this itself can lead to the development of colon cancer. Along with all this, if you have any first degree relatives who were diagnosed with colon cancer, then your chances of developing cancer definitely increases. So what do we do? Now, that is why we are creating cancer awareness, where we want to bring your attention to this concept called screening. What do we do in screening? Screening is where we perform a couple of tests where we want to pick up cancer in much earlier stages. That way, we would be able to provide better cure for the patient. So when should you start screening? Ideally, when it comes to colon cancer, if anybody in your family was already diagnosed, then you have to start screening 10 years before your uncle or your aunt or your relatives were diagnosed with colon cancer. Otherwise, at least from the age of 45, screening has to be started. So what do we do in screening? Ideally, a colonoscopy is done once in 10 years, or a flexible sigmoidoscopy can be done once in 5 years. Double contrast barium enema is done once in 5 years. Along with this, there are also multiple tests which can be used as supportive tests for the diagnosis of colon cancer. So once diagnosed with colon cancer, what next? Now, colon cancer can be treated with surgery, radiation, or chemotherapy. Surgery definitely is the mainstay of treatment, where they operate and remove the tumor. Sometimes, if the tumor is too big and it would be difficult for the surgeon to operate, then we give chemoradiation, where we try to shrink the size of the tumor and make it more easier for the surgeon to operate and remove. So coming to radiation in particular, as you all know, radiation is using X-rays to kill cancer cells, and it is a painless mode of treatment. So in radiation, there are two very broad approaches that we have, that is the long course radiation and short course radiation. This again depends on multiple tumor and patient characteristics. In a long course chemoradiation, what we do is we have about 28 sessions of radiation, and radiation is given from Monday to Friday, that is 5 days a week, and Saturday and Sunday are given as rest days. When it comes to short course radiation, you have 5 sessions of radiation, followed by that the patient would be taken up for surgery. So this is regarding the treatment of colon cancer. Now with this, I definitely hope that all of you have got a very brief idea regarding what happens when someone is diagnosed with colon cancer. But before I end this talk, I would like to say that prevention is definitely in our hands. So kindly look into your diet. Please include fiber-rich diet. Reduce the consumption of fatty foods, junk food, processed food. And you may as well protect yourself and your family from development of this colon cancer. And by saying all this, if any one of you have had such symptoms or your relatives have developed such symptoms and you have discussed these problems before, kindly reach out to us at Dr. Kamakshi Memorial Hospital. We will definitely be able to guide you through this process. And I would extend my support to all colon cancer patients, cancer survivors and their family to have braved through all this. Thank you.